Hello and welcome to the Fitness and Physical Activity segment of this DVD from the Florida Department of Health, Disability and Health Program and the National Center on Health, Physical Activity and Disability. Just like everyone else, people with disabilities need regular physical activity and exercise in order to lead a healthy life. The Centers for Disease Control and Prevention recommends that adults get 30 minutes of some type of physical activity or exercise at least 5 times a week. For children, the CDC recommendation is 60 minutes of exercise at least 5 times a week. Now, while a person with disabilities may not be able to meet the recommendation, it's still very important that they avoid inactivity and get involved in some form of exercise that matches their abilities. In this video from the National Center on Health, Physical Activity and Disability, a center located within the University of Alabama in Birmingham Lakeshore Foundation Research Collaborative, will give you some helpful tips and demonstrate how a person with a disability can participate in an active lifestyle.
Hi, my name is Carol Kudik, and I'm the Director of Fitness and Health Promotion at the Lakeshore Foundation. I have a master's degree in exercise physiology, and I specialize in creating exercise programs for individuals with physical disabilities and chronic health conditions.
Hello, my name is Beth Curry. I'm the Chief Program Officer at Lakeshore Foundation. I'm a physical therapist by profession.
Hi, my name is Jason Diaz, and I'm a fitness specialist at Lakeshore Foundation, and I have a master's in adaptive physical activity.
I'm Carrie Vanderbaum, and I am a postdoctoral fellow here at the UAB Lakeshore Research Collaborative, and I have a PhD in exercise and sport science.
Hello, my name is Lori Malone. I am the research coordinator for the UAB Lakeshore Research Collaborative. I have a PhD in exercise science with a specialization in adapted physical activity.
Today we are going to discuss the ins and outs of beginning an exercise program and what to do if you'd simply like to add some physical activity to your daily routine. We hope to explain the importance of exercise, the safety components necessary to have a successful exercise program, the different types of exercises, and the overall benefits that can result from you leading a healthy and active lifestyle.
Before anyone begins an exercise program, there are some general safety issues you should be aware of. First, stop exercising if you experience pain, discomfort, nausea, dizziness, lightheadedness, chest pain, irregular heartbeat, shortness of breath, or clammy hands. Any of those could be an indication that something is wrong. Remember to always drink plenty of water before, during, and after exercise. And if you're sore after an exercise session, keep drinking lots of water to help the soreness go away.
You want to wear the appropriate clothing for whatever type of exercise you will be doing. For example, if you are going to be swimming, get a properly fitting swimsuit. If you will be exercising in a gym, be sure to wear comfortable and breathable clothes like gym shorts and a t-shirt or dry fit shirt. And always wear closed-toed shoes. Make sure that you are following an exercise program that is specific and appropriate for you. Don't just do one that you have seen on TV or one that someone else has done. And finally, check your blood pressure and blood sugar levels before exercising to make sure that they are acceptable levels before beginning your exercise program. This may be something that you need to talk with your doctor about if you commonly have issues with it.
When starting an exercise program, your first few steps can be the most important to leading you down the path of a healthy and safe lifelong program. Your first step should be to inform your physician or primary caregiver that you are considering starting an exercise program and see if they have any precautions or suggestions for you. Your second step, if possible, is to see if you can participate in exercise testing to determine your current level of fitness. Many gyms offer this during their orientation or might be able to request it from a personal trainer. This will help you start off on the right level for you. If you take any medications, your next step should be to find out any effects they may have on exercise. It might be written on the label, or you can ask your doctor or pharmacist. And the last step to lead you in the right direction is to consult a trained exercise professional before beginning your exercise program. This should be someone who is familiar with your disability and can offer you some sound exercise advice.
A proper exercise routine can help you avoid numerous other health complications, but there are some that you need to be aware of and avoid exercise if you are currently experiencing any of them. Once the health complications have healed or gone away, it should be safe to resume activity, but it's always best to check with your doctor first. Skin breakdowns, also known as pressure sores, can be life-threatening if not treated. Due to lack of feeling and decreased circulation, a tiny scratch can turn into something serious. Protect your skin by being conscious of where you are and what you are sitting on. Watch for any red spots Any continual rubbing can cause problems. UTIs, this stands for urinary tract infection and can be quite common among individuals with disabilities, particularly those who use catheterization to empty their bladder. Be sure to always thoroughly clean your catheters and leg bags to avoid any infection. A UTI can really alter the way you feel and might not be the best time for you to exercise if you currently have one. Orthostatic hypotension is a drop in blood pressure that can occur when changing to an upright position, like from lying down to sitting up. Your symptoms may include nausea, dizziness, and lightheadedness. Be aware of this when you are working out. If you feel lightheaded, try holding your breath as you sit up. Some tips to help you avoid orthostatic hypotension include things like monitoring your blood pressure often, avoiding quick movements, maintaining proper hydration, and using compression stockings. Thermoregulation can also be a life-threatening situation for individuals with certain injuries. People with higher level injuries have a hard time regulating their body temperature and often lose the ability to sweat below their level of injury. If this is the case for you, be sure to take other precautions to make sure you don't get overheated. To prevent any issues, you can wear appropriate clothing and drink plenty of fluids. In warm environments, it may be beneficial to keep a fan, cold towel, or a spray bottle nearby to keep you cool. Autonomic dysreflexia is another condition that can become life-threatening if left untreated. As a person with a high-level spinal cord injury, you may not notice pain indicators when something is wrong below the level of injury, but your body will find a way to let you know that something's wrong. This reaction is known as autonomic dysreflexia, and the symptoms can include headache, nausea, stuffy nose, sweating, high blood pressure, goosebumps, or a slow pulse. Causes of autonomic dysreflexia can range from a bladder infection to an ingrown toenail, or from a fracture to a bug bite. Be sure to check yourself often and get rid of whatever is causing the reaction.
There are numerous benefits to exercise, and the benefits almost always outweigh the costs. Benefits include increased heart rate and lung function, improved ability to perform activities of daily living, protection against the development of chronic diseases, decreased anxiety and depression, enhanced feeling of well-being, weight control, lower cholesterol and blood pressure, decreased risks of cancer, feeling better, looking better, and moving better. Each of those can stand alone, but together those benefits make exercise almost sound like a magic pill.
Now let's talk exercise. There are three major fitness components that we will talk about today. The first is aerobic. Aerobic fitness is anything that gets your heart pumping, also known as cardiovascular exercise or just cardio. You need at least 30 minutes of cardio activity most days of the week for general health benefits. However, if you want to lose weight or improve mobility, it will require about 60 minutes most days of the week. Not all activities are created equally. The main thing you want to focus on is intensity. Make sure that whatever exercise you choose for your cardio is actually making you work. Some examples may include swimming, walking, or pushing, and biking. There are a number of different ways you can measure exercise intensity. The first is heart rate. Determine your heart rate by finding your pulse. Place a finger on the thumb side of the bottom of your forearm near your wrist or against your neck and count the pulse beat for 10 seconds. Multiply this figure by 6 to calculate your heart rate per minute. Note that you should never use your thumb to take your pulse because it has a pulse of its own.
Secondly, you need to know what your maximum heart rate is. To find out, subtract your age from 220 to determine your maximum heart rate. An example would be a 40-year-old person would have a maximum heart rate of 180 because 220 minus 40 equals 180. Next, you have to calculate your target heart rate. This is sometimes referred to as the exercise benefit zone, meaning the range where you will get the most benefit out of your exercise program. This range is anywhere from 60% to 80% of your maximum heart rate. For the top cutoff point, multiply 0.8 by your max heart rate. For the lower cutoff point, multiply by 0.6. For the example above, this would put their target heart rate between 108 and 144. So when you're doing cardio exercise, your goal should be to maintain the target heart rate.
Now, it is important to note that individuals with neurological conditions, high-level spinal cord injuries, or those taking beta blockers may have alterations in their heart rate, which may make this method inaccurate. For those individuals and others, there are two other ways to measure exercise intensity. The first is rate of perceived exertion. RPE is a scale of how hard you feel you're exercising. This scale, called the Borg scale, ranges from 6 to 20. To use the scale, you want to monitor how you feel you are exercising with a general goal of 12 to 13 RPE.
The last option is the talk test. If you can sing while performing cardio exercises, you aren't working hard enough. If you can talk while stopping occasionally to take deep breaths, you are working at a good rate. And if you can't talk at all, your intensity is too high. Now, if you don't have 30 minutes to get your cardio in, or 30 minutes in a row is too much for you right now, you can get bouts of exercise in 5 to 10 minute increments and add them up throughout the day.
The second fitness component is strength training. This component can make a huge impact in your daily living activities and make it easier to get around in general. A typical strength training program includes all major muscle groups. For individuals who use wheelchairs, it will include smaller muscle groups. Major muscle groups include biceps, triceps, chest, back muscles, as well as hamstrings, quads, and glutes. Which muscles you are able to work will be different for everyone. Active movement means you are doing the work, while passive movement means someone or something else is doing it for you. Active movement is great to increase muscle strength, while passive movement should only be used in range of motion exercises and not involve a lot of weight. If you get stuck trying to work a muscle group, try to think outside the box and make that movement happen. Some common strength training terms include sets and reps. A set is a complete set or round of a given number of repetitions. This typically refers to just one exercise. You should always rest after you finish a set of exercises. Reps are the number of times you should perform an exercise in a row. A typical routine might state do 3 sets of 10 reps. This means you would complete 10 reps of a given exercise and rest and repeat 3 times. Flexibility is the third and final component we will discuss. Full body flexibility is one component that is often neglected in individuals with a disability. Having a good flexibility program can help with circulation in your extremities that may have reduced blood flow. It can also help with countering the stiff position that comes from sitting in a wheelchair. Being able to straighten your legs fully or lie flat can help in many situations. Therefore, a good flexibility program should stretch all major muscle groups.
When you're starting out a stretching program, you should hold each stretch for at least 10 seconds. Gradually, you will want to work your way up to longer holds. You can hold some stretches up to a full minute. You should perform at least 2 reps of each stretch. On the second rep, try to hold your stretch a little bit further than your first. Your flexibility program can be performed most, if not on all days of the week and multiple times during the day. One key point to remember is that you never want to stretch a cold muscle. Make sure that you have done something to warm those muscles up, like going for a brisk walk or push before you stretch.
Once you are ready to start a fitness routine, it's as easy as 1, 2, 3. Number 1, warm up. Do any type of light movement that slowly elevates your heart rate and get your muscles warm. This can be an easier version of what you're about to do, or can be as simple as an easy push or light arm bike exercise. 2, exercise. This section should consist of at least 30 minutes of cardio like we talked about earlier. Your heart rate should remain elevated for the entire time. Number 3, cool down. Don't just abruptly stop your workout. Instead, slowly bring your heart rate back down by doing some light movements similar to those used in the warm-up.
One principle that is important to remember when designing your exercise program is the FIT principle. F is for frequency. This refers to how often you should do the exercise. The Surgeon General recommends performing aerobic exercises most days of the week and strength training and flexibility exercises 2 to 3 times per week. I, for intensity, refers to how hard something is. This could be in relation to speed or incline when talking about cardio exercises, or the amount of weight lifted when talking about strength training. T for time refers to the duration or how long you should exercise. With cardio exercises, your goal should be a minimum of 30 minutes or shorter bouts that can be added up to equal 30 minutes. In strength training, time refers to sets and reps. You can start with as little as 1 set of 10 reps and gradually work your way up to 3 sets of 10 or 15 reps. T for type, also known as mode, refers to what type or what kind of exercise you will be doing. Structured cardio examples include walking, wheeling, running, cycling, swimming. Resistance training examples can include free weights, machines, or body weight. Unstructured examples can include everyday things like gardening, household cleaning, or walking to work. When you think about your exercise plan and set your exercise goals, Be sure to include all of these components.
You may have recently acquired your disability or may have had it for a long time. Either way, you may not be able to do some of the exercises the way you used to, but that doesn't mean that you can't do the exercise at all. There are plenty of ways to do things that will still produce the same effect. For instance, maybe a standard push-up is not the best option because you can't hold your hips off the ground. Instead, try doing a push-up off a bench or a mat. To increase the intensity, come as far off the mat as you're able to. For other exercises, you may have to strap yourself to a bench if you don't have enough core strength, or some exercises you use to perform standing, you may now have to be seated or lying down, but you can still do them. Dips are another great example, and they are paramount in helping you transfer independently. If you can no longer do these off the side of a bench, try getting between two benches or chairs, or by using the arms of a chair or your wheelchair.
If you don't have access to a gym, you can still get a good workout at home. Body weight exercises or using items around your house are a great way to build strength without any weight equipment. Things like push-ups and dips, like we just talked about, are great at working the muscles you use to transfer. Another home option is calisthenics. This just means body movements that can get your heart rate up. Exercises of these include arm jacks, arm circles, and punching motions.
Here is an example of a home workout. Complete 3 sets of 10 repetitions for each of these exercises. Chair push-ups. Using your wheelchair or a chair with arms, place your hands slightly behind you on the arms and push up until your elbows are fully extended and your body comes out of the chair. Arm circles. Hold your arms straight out to the side and perform a circular motion with both. Bicep curls. Using a soup can or other household item, start with your arms down by your side and then curl your arm up to your shoulder. Sitting wall push-ups. Sit in a stationary chair or your wheelchair facing the wall with your arms at chest height and elbows bent. Place your hands on the wall and then fully extend your elbows, pushing your body away from the wall. Arm jacks. Perform the motion of a jumping jack with just your arms. Shoulder press. With a soup can or other household item in each hand, start with your hands at shoulder height and push straight up. Seated crunches. From a seated position, bend over and try to touch your toes. Then bring your arms up and fully extend them over your head.
Ready to take it up a notch? Do those same exercises Tabata style. This means you will do each exercise for 4 minutes, doing 20 seconds of work followed by 10 seconds of rest, repeatedly for 4 minutes. You can also add exercises like push-ups, dips, and mountain climbers for the arms.
So what about outdoor recreation? You certainly don't have to keep exercise indoors. You can get just as many benefits and have fun while doing exercise in the great outdoors. Outdoor activities are almost limitless. You can enjoy everything from going for a bike ride to snow and water skiing. And when you exercise outdoors, the same principles apply. For cardio, make sure you are still getting 30 minutes of exercise with an appropriate intensity level. You also still want to have a warm-up, exercise, and cool-down phase. One of the easiest ways to exercise outdoors is by going for a walk. Walking can mean many different things to different people. Some people may walk using their legs, while some people use a wheelchair, and others may use sticks, crutches, or canes. But regardless of how you walk, it can be a great way to get cardiovascular exercise. If you don't live in an area where you can just go for a walk right out your front door, you can always go to a local park or walking trail. Florida has numerous walking and hiking trails all throughout the state. To find one near you and note its accessibility, you can go to floridahikes.com and search accessible trails. To find more information on exercising with a disability, feel free to visit the National Center on Health, Physical Activity, and Disability online at nicpad.org. Here you can search an extensive online database full of videos, articles, and even workout programs catered to users such as yourself.
We hope this has given you valuable information on how to stay active and healthy. You can see that being healthy and having a disability is a possibility. If you have any questions about the material presented today or need additional information, please contact the Florida Department of Health.